Hi, I'm Betsey McCormick. I'm a physical therapist here at St. Luke's Physical Therapy on 8th Avenue in Bethlehem.
And I'm Kristen Topping. I'm also a physical therapist here. In our last video, we explained to you what BPPV was and why it's important to get treated. And today we want to discuss how we diagnose that and how we treat it as physical therapists.
So your symptoms are going to tell us a whole lot about what kind of vertigo that you have. So typically when somebody has BPPV, they're going to describe their dizziness as a strong room spinning dizziness. Symptoms typically won't last for more than 30 seconds to 1 minute. And usually they always come on with a position change. So first thing, sitting up in the morning, bending over, lying down in bed, or rolling over in bed are all typical times that somebody will say that they start to get their dizziness.
Since this is a positionally dependent dizziness, we're going to run a series of positional tests. The most common test that we use is called the Dix-Hallpike. It tests for the most common type of dizziness, or BPPV, which is in the posterior canal. If you remember in our last video, we explained to you that the vestibular system is made up of 3 semicircular canals, and that posterior canal is the one that's most involved. So I'm going to demonstrate that for you right now with Betsey.
Hey, Kristen, question for you.
Sure, what's up?
Do you need an MRI or a CT scan to tell you whether you have BPPV?
You know, that's a great question, Betsey, and the answer is no, you don't. Our positional tests are sensitive and specific enough to tell us what canal and what side is involved.
Great, thank you.
Sure. All right, so let's get to it. Let Betsey sit on the table here with her feet straight out in front of her. I'm going to ask her to take off her glasses because I'm going to be looking at her eyes. We're going to rotate her head 45 degrees to the right, so this means I'm testing the right side. On the count of 3, Betsey's going to lay back as quick as she can. 1, 2, 3. Keeping her eyes open, I'm looking for something that we call a nystagmus. That's a rotation in the eyes. The nystagmus can tell me what side is involved and what canal is involved. I'm also going to ask Betsey if she's feeling dizzy.
Very dizzy. It's super room spinning dizzy.
Sounds like a positive test to me. Okay, let's sit on up.
So if for any reason you can't be in that position with your head hanging off the table, we have other tests that we can try that are also reliable and sensitive and specific that can tell us where the BPPV or where that crystal might be loose.
Exactly. Okay, so now that we showed you the test, we want to show you the most common maneuver that we use, and that's called the Epley Maneuver. The maneuver is going to start in the same way that we started our testing. So I'm going to have Betsey sit with her legs straight out in front of us. So when we did our test, we tested her right side and we found a positive. But for demonstration purposes today, I'm going to show you what a left Epley maneuver is to treat the left side. So I'm going to rotate Betsey's head 45 degrees to the left, and on the count of 3, she's going to lay down as quick as she can. 1, 2, 3. Here, I'm asking about dizziness, and I'm looking for that nystagmus. I'm going to wait for those symptoms to subside, plus another 30 seconds. When that 30 seconds is up, we're going to rotate Betsey's head to the right. I'm going to ask again for dizziness. If there is dizziness, we're going to let it subside, plus another 30 seconds. After that, I'm going to have Betsey roll onto her right side, and I'm going to turn her head, tuck it in. Same thing, I'm going to see if she's dizzy. Wait for that to subside, plus another 30 seconds. When that's up, we're going to have Betsey sit on the edge of the table, nice and still. Ask her to keep her head nice and still. We're not going to move. She might feel a little woozy, a little dizzy. We're going to wait till that subsides before we go into anything else.
Messed up my hair though.
I'm sorry, it happens.
So you can see it's just a quick series of position changes to help to replace those crystals. Within 1 to 2 treatment sessions, most of the time, it'll get rid of your symptoms altogether, and you'll be back on the road to recovery.
Right. So if you think that you're having dizziness or if you're suffering from BPPV, please don't hesitate to call us at 484-526-5025 or visit us at our website at www.stlukesphysicaltherapy.com.
Yeah, and most of the time you don't need a prescription from your doctor. You can just give us a call and we'll get you right in. And also keep in mind that we are offering virtual visits as well as in-office visits at this time.
Thank you.
Thank you.